My dear students, a very warm welcome to you all in this session of anatomy where we are going to discuss about the skeleton of the foot. The skeleton of the foot can be viewed from different perspectives. Here we are showing you the dorsal view and the plantar view. The dorsal view is onto the left is the dorsal view, onto the right it is the plantar view. Apart from these two views, we can also see the skeleton from the side. Considering on whether we are seeing the skeleton from the lateral side or from the medial side, there are lateral and medial views. So let's see. The next diagram, we are seeing the medial and lateral views. The first one is the medial view and the next one is the lateral view. How do I determine the medial and lateral side? In the lower limb, in case of foot, the side of the great toe belong to the medial view and the side of the little toe belong to the lateral view. If you remember this dictum, you can easily determine the side by just taking a look at the skeleton. Okay, so we have seen the dorsal view, plantar view, medial view and lateral view. These four views will ultimately guide us through the discussion of the skeleton of the foot. Let's go back to the first diagram. Now I have already told you that lots of bones are present in the skeleton of the foot. How many bones are there? There are altogether 26 bones. These 26 bones have been categorized into three broad types, from proximal to distal. The most proximal group is called the tarsal bones. The proximal group is the tarsal group. Tarsal group. Okay. In the tarsal group, there are 7 individual bones. 1, 2, 3, 4, 5, 6, 7. Like that. 1, 2, 3, 4, 5, 6, 7. 7 bones in the tarsal group. The tarsal group is followed by the metatarsals. Here. Metatarsals. And in the metatarsal there are 5 bones. 1, 2, 3, 4, 5. The numbering convention is from the medial side to the lateral side. 1 is the most medial metatarsal and 5th one is the most lateral metatarsal. So metatarsal bones are 5 in number, tarsal bones are 7 in number. And last but not the least, the bones of the fingers, the phalangeal bones or phalanges. How many phalanges are there? There are 14 phalanges. There are 2 for the great toe and rest of the 4 toe have 3 phalangeal bones each. So 4 into 3, 12 plus 2, 14 bones. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 bones. So when you add up these numbers, then the tally goes to 26. 14 plus 5 plus 7. So what are the total number of bones that form the skeleton of the foot? Total there are 26 bones forming the skeleton of the foot. Okay. So that is the first part of our discussion. Total number of bones forming the skeleton of the foot is 26 bones and they are divided into 3 broad categories: tarsals, metatarsals and the phalanges. Next we will discuss about the individual bones, starting from the tarsal bones, then covering the metatarsal and last but not the least the phalangeal bones. Now from the exam point of view, of all these 26 bones, the tarsal bones, namely talus, calcaneus and the navicular cuboid, they are the most important bones, and in the metatarsals, the first metatarsal bone is the most important. So we must lay emphasis on these few bones, and for the other bones we will go in a superficial manner, and that will be suffice for the exam purpose. So now we are coming back to the description of the tarsal bones. So tarsal bones, over here, this group of bones, tarsal bones, they are 7 in number and they are actually short bones. The category of bone is short bones. You know that according to the shape, the bones have been divided into long bones, short bones, sesamoid bone, accessory bone, irregular bone, pneumatic bone, etc. So according to the shape, the tarsal bones belong to the category of short bones, and in between the tarsal bones there are again 3 rows. There are again 3 rows of tarsal bones. What are the rows? Let me show you the rows of the tarsal bones. Proximal row consists of talus and calcaneus. This is the talus and this one is the calcaneus. So talus and calcaneus together form the proximal row. Talus and calcaneus, proximal row. From the plantar view, it is the calcaneus, it is the talus. So they together form the proximal row. The navicular bones form the middle row. Alone navicular bone. This navicular bone form the middle row. And the rest of the 4 bones, that is the 3 cuneiforms and 1 cuboid. The 3 cuneiforms, 1, 2, 3 cuneiforms, and the cuboid, they together form the distal row. So 1, 2 and 3, they are cuneiforms. So cuneiform 1, 2, 3 plus cuboid, they form the distal row. Okay, so proximal row, middle row and distal row. This way the tarsal bones are organized. In between all these bones, all these tarsal bones, the calcaneus is the largest and strongest of them all. So calcaneus, it is the largest and strongest, and the second largest is the talus. So talus is the second largest. So calcaneus is followed by the talus. Okay, now we will talk about the cuneiform bones. Cuneiform bones. The cuneiform bones are present between the navicular behind and the metatarsals in front. There are 3 of them. So there are 3 cuneiforms and they are named as medial, intermediate and lateral. This is the medial cuneiform, followed by intermediate cuneiform. Next to it is the lateral cuneiform. These 3 cuneiform bones, that is the medial, intermediate and lateral, they are also known as the first cuneiform, second cuneiform and third cuneiforms respectively. Of these 3 cuneiform bones, the medial cuneiform is the largest. Medial cuneiform, largest, and the intermediate cuneiform is the smallest. Intermediate cuneiform, smallest. Now the cuneiforms present a proximal articular surface and distal articular surface. So first we clear the picture and next we discuss about the articular surfaces. These are the proximal articular surfaces of the cuneiforms. The proximal articular surfaces of the cuneiforms articulates with the navicular bone. Okay, so proximal articular surface that articulates with the navicular. Now we are going to discuss about the distal articular surface. The distal articular surface of the medial cuneiform, it articulates with the base of the first metatarsal. This is the first metatarsal having base, shaft and head. So base of the first metatarsal articulates with the distal articular surface of the medial cuneiform. Similarly, distal articular surface of the intermediate cuneiform, it articulates with the base of second metatarsal. Base of second metatarsal. The distal articular surface of lateral cuneiform, this one, distal articular surface of the lateral cuneiform, it articulates with the base of third metatarsal. Third. In between the three cuneiforms, the intermediate cuneiform, which is the smallest in size, it provides the most stable platform for the base of the second metatarsal. That means the base of the second metatarsal is the most fixed or secured. Now we are going to discuss about the navicular bone. In Latin, the term navicular means a little ship. Navicular bone, meaning a little ship. This is the outline of navicular bone. Navicular, from the plantar aspect, here goes the navicular. The navicular bone presents 6 surfaces: anterior surface, this one, anterior surface. Number 2, opposite to it is the posterior surface. Number 3 and 4, the medial surface and the lateral surface. And then 5 and 6, the dorsal surface and the plantar surface. So dorsal surface, this is the dorsal surface and this one is the plantar surface. So 5 dorsal surface, 6 plantar surface, 6 surface of the navicular bone. Now we discuss about the individual surface one by one. Let's clear the picture. First of all, the anterior surface. The anterior surface is convex and it possesses 3 articular facets for the 3 cuneiforms. So one for the medial cuneiform, one for the intermediate cuneiform, another for the lateral cuneiform. 3 facets for 3 cuneiforms. And among them the medial facet is the largest. So anterior surface, there are 3 facets for the 3 cuneiform bones. Posterior surface is concave. posterior surface is concave, and it articulates with the head of the talus. We know that the talus presents a head followed by a neck, lastly a body, three segments. So the head of the talus, which is the most anterior portion of the talus, the head of the talus fits into the concavity of the posterior surface of the navicular bone. So posterior surface, head of talus. Next we will talk about the medial and lateral surface. In the medial surface we will see a projection like this. That projection is called the tuberosity of the navicular bone. So medial surface, it presents what? Tuberosity. This tuberosity of the navicular bone provides insertion to the major part of tendon of tibialis posterior. So here tibialis posterior tendon takes its insertion majorly in the tuberosity of the navicular, which is present in the medial surface. Lateral surface is opposite the medial surface. Lateral surface, it is rough and provide a socket for cuboid. So lateral surface provide a socket for cuboid. Lateral surface, socket for cuboid. Coming to talk about the dorsal surface and plantar surface. The dorsal surface, it is convex and rough dorsal surface, and it provides attachment to the dorsal talonavicular ligament. How the talonavicular ligament looks like? This is the outline of dorsal talonavicular ligament. Dorsal talonavicular, that means that attaches the dorsal surface of the navicular with the talus. So dorsal surface gives attachment to dorsal talonavicular ligament. What about the plantar surface? Plantar surface, we will see the plantar surface in this diagram, right? This one is the plantar surface. What is important in the plantar surface? The plantar surface presents a groove in its medial part through which passes the tendon of tibialis posterior. So here is a groove in the medial part for the passage of the tibialis posterior. Passage of tibialis posterior. Lateral part of the plantar surface provides attachment to the spring ligament. Lateral part of the plantar surface, this provide attachment to spring ligament. Spring ligament spans like this. The blue lines outline the spring ligament. Spring ligament has other name, that is called plantar calcaneonavicular ligament. So it is present on the plantar surface of the foot and extending between the calcaneus and the plantar surface of the navicular. So it is called plantar calcaneonavicular ligament. So lateral part of the plantar surface of the navicular gives attachment to the spring or plantar calcaneonavicular ligament. So plantar surface is divided into medial and the lateral part. The medial part presents a groove for the tendon of tibialis posterior, and on the lateral part there is site of attachment of spring ligament. That is all about the navicular bone. Now we are going to talk about the calcaneus. The calcaneus is known as the heel bone. First I would show you the outline of the calcaneus from the dorsal view. This is the calcaneus from the dorsal view, sitting below the talus, and from the plantar view there goes the outline of the calcaneus. Calcaneus is the largest and strongest bone of the foot. Calcaneus, it is the largest and strongest bone of the foot. If you take a look at the calcaneus from the side view, then you will see that calcaneus sits not only below the talus, but a part of calcaneus extend beyond the talus. So let's see the side view. Now in the side view, first we identify the calcaneus outline. This is the calcaneus or the heel bone outline of it from the medial view. From the lateral view, the calcaneus is defined like this. Calcaneus. Now on top of the calcaneus is the talus, which is the second largest bone. Calcaneus is the largest bone, followed by talus, which is the second largest bone of the foot. Similarly here, outline of the talus like this. Talus. Now these two diagrams, they reveal that a part of calcaneus is sitting underneath the talus, this portion, and a part of calcaneus is extending beyond the talus. So in the descriptive term, we can write that calcaneus is situated below the talus and also extend behind the talus. So the exact location of the calcaneus is to be described like calcaneus is present below and behind the talus. Below and behind talus. That will be the correct explanation. Now the calcaneus present 6 surfaces. So let us see what are the surfaces of the calcaneus. From this type of view, we can easily make out the following surfaces. First of all is the anterior surface, this one, anterior surface. Okay. Opposite the anterior surface, this is the posterior surface, obviously, anterior, posterior. Then from above, this portion represents the superior surface. Similarly, opposite the superior surface, this is the inferior surface. And on both sides of the feet, we can see the surfaces on the lateral sides and medial sides. So this is the lateral surface seen from the lateral aspect. Lateral surface. Similarly, from the medial aspect, we can get to see the medial surface. So how many surfaces are there? Obviously there are 6 surfaces: anterior surface, posterior surface, superior surface, inferior surface, lateral surface, medial surface. So there are 6 surfaces in the calcaneus, which is the largest and the strongest bone of the feet. Now regarding the different surface, now we will discuss. We start first with the posterior surface. Okay, the posterior surface, as I have already showed you. So this one is the posterior surface, already mentioned. This posterior surface is divided into the following 3 parts: upper 1/3, middle 1/3 and lower 1/3. So first of all, upper 1/3. This upper 1/3 is smooth and it is related to a synovial bursa. So there is nothing important in the upper 1/3. Regarding middle 1/3, it provides attachment to tendocalcaneus and plantaris. Now tendocalcaneus is a tendon. So let me first draw the tendon. So there is a tendon like this. This tendon is one of the strongest tendon of the body, and this is actually a common tendon or conjoint tendon of three muscles, two head of gastrocnemius and one soleus. So let me draw the muscles which give rise to the tendocalcaneus. So here goes the gastrocnemius muscle, medial and lateral head. They are the two heads of gastrocnemius. One is the medial head, one is the lateral head of gastrocnemius. Along with them there is another muscle that is called the soleus. So we'll also draw the soleus muscle like this. Soleus, this is the gastrocnemius, this is the soleus. So this conjoint tendon of gastrocnemius and soleus is known as a tendocalcaneus, and that is inserted into the middle one third of the posterior surface. Apart from this tendocalcaneus, the tendon of plantaris, plantaris is another muscle, it is a very slender muscle, plantaris, plantaris. So the tendon of plantaris, apart from the tendocalcaneus, is also attached to the middle one third of the posterior surface. So this is the tendocalcaneus, tendocalcaneus equals to conjoint tendon of gastrocnemius plus soleus. Okay. Now coming on to the lower one third. Regarding lower one third, it is subcutaneous as it is entirely weight bearing during the standing posture. So lower one third, this portion is the weight bearing portion of the calcaneus. Okay. So lower one third, it is weight bearing. So that is the way the posterior surface is described. So one of the surface has been described. Next is the anterior surface. The anterior surface is the smallest of the 6 surfaces, and it bears a concavo-convex articular facet to articulate with the cuboid. Okay. So anterior surface of the calcaneus, it articulates with the cuboid and it is concavo-convex in nature. Anterior surface, concavo-convex, right? So anterior and posterior has been sorted. Next we will discuss the superior or dorsal surface, followed by the plantar surface. So let's see the dorsal and plantar surfaces. First, about the dorsal surface. The dorsal surface can be seen when we remove the talus bone from the dorsal view. If we remove the talus bone from the dorsal view, then the dorsal surface of the calcaneus will be revealed. Here is an isolated calcaneus after the removal of the talus. What we see? We see that the superior surface is divided into 3 segments: posterior one third, middle one third, and anterior one third. Okay. So the talus has been removed from the dorsal view, and after removal of the talus, the dorsal surface of the calcaneus, which was underneath the talus, is revealed, and we divide it into anterior one third, middle one third, and posterior one third. Okay. Let's clear the picture once again. Posterior one third is rough and is covered with a pad of fibrofatty tissue. So first posterior 1/3. It is rough and covered by fibrofatty tissue. Fibrofatty tissue. Now it is the turn of middle 1/3. What about the middle 1/3? In the middle 1/3, we get to see a large facet, articular facet. This articular facet in the middle 1/3, this articular large facet, it is called the posterior facet for talus. It is called posterior facet for talus. Why? Because the talus is sitting on top of it. There are three facets for the talus: anterior, middle and posterior. The posterior facet for talus is present on the middle third of the dorsal surface. Then we come to the anterior 1/3. Anterior 1/3. And we get to see in the anterior 1/3 that it presents two articular facets. Anterior 1/3 presents one and two articular facet. Okay. The anterior one is called the anterior facet for talus. This is called anterior facet for talus. Okay. Followed by this one, it is called the middle facet for talus. Middle facet for talus. Anterior facet for talus and the middle facet for talus. Right? So we have briefly described the superior surface by dividing into three segments. Now in the anterior 1/3, apart from the anterior facet and middle facet, there is a non-articular part as well. This is the non-articular part of the anterior 1/3, non-articular part, right? So we can clear the diagram and focus on the non-articular part of the anterior 1/3 without any facet. Non-articular part of the anterior 1/3. Non-articular part of anterior 1/3. It is divided into a medial narrow and lateral wide part. So a medial narrow part and a lateral wide part. Medial narrow, lateral wide portion. The medial narrow part is grooved and it is called the sulcus calcaneus. The medial narrow part, it is like a groove and it is called sulcus calcaneus. Medial narrow part. And it provides attachment to the interosseous talocalcanean ligament. Interosseous talocalcaneal ligament. And the lateral part is wide, large and provides attachment to extensor digitorum brevis, inferior extensor retinaculum and stem of bifurcate ligament. In the lateral part there is attachment of extensor digitorum brevis, then the inferior extensor retinaculum, inferior extensor retinaculum and stem of bifurcate ligament. These three things. Okay. Extensor digitorum brevis, inferior extensor retinaculum and stem of bifurcate ligament. Next I will discuss about the plantar or inferior surface of the calcaneus bone. What about the plantar surface? Here goes the plantar surface of the calcaneus. Plantar surface is rough and provides three tubercles. On the anterior end there is the anterior tubercle, and in the posterior end there is a large medial tubercle and a small lateral tubercle. So altogether there are three tubercles. So plantar surface, three tubercles: anterior, medial, lateral. The medial and lateral tubercles together, they are known as the calcaneal tuberosity. So together these two tubercles provide an elevated area which is known as calcaneal tuberosity. Now important is that in between these three tubercles there is a triangular area. So there is a kind of triangular area like this in between the three tubercles, and this triangular area between these three tubercles provide attachment to the long plantar ligament. Attachment of long plantar ligament. Okay. So let me show you the long plantar ligament. This is the plantar surface of the foot with the ligaments, and these outline belong to the long plantar ligament. Now there are the tubercles. I will outline the tubercles here: lateral tubercle, medial tubercle, and anterior tubercle. In between them three there is a triangular area which provide attachment to one end of the long plantar ligament, and the other end you can see it is attached to the base of the metatarsals. Long plantar ligament. Okay. Now in front of this anterior tubercle there is a groove. In front of the anterior tubercle, this is the medial tubercle and lateral tubercle. In front of anterior tubercle there is a groove. On the plantar surface. These groove in front of this is the anterior tubercle, medial and lateral tubercle. So this groove in front of the anterior tubercle gives attachment to the short plantar ligament. In this diagram, this is the outline of short plantar ligament. So short plantar ligament lie below the cover of the long plantar ligament. When we cut the long plantar ligament, we get to see the short plantar ligament. This is the short plantar ligament. Okay. Short plantar ligament. So that is about the plantar surface. So plantar surface, you have to remember three tubercles and two ligaments. These three tubercles are anterior, medial, and lateral tubercles, and the two ligaments are long plantar and the short plantar ligament. And the short plantar ligament lies under cover of the long plantar ligament. Next, we will go into the lateral and the medial surface. So on to the lateral surface first. In the lateral surface, it is a flat surface. The lateral surface is the flat and subcutaneous. Flat lateral surface. It presents a small elevation in its anterior part. There is a small elevation over here, which is called the peroneal trochlea. What is the name? Peroneal trochlea. This peroneal trochlea lies between the groove for the tendon of peroneus brevis above. The tendon of peroneus brevis was above it, and the tendon of peroneus longus was below it. So above goes the tendon of peroneus brevis. Below goes the tendon of peroneus longus. Okay, that is about the lateral surface. So lateral surface, peroneal trochlea, above the peroneal trochlea, peroneal brevis, below it is the peroneus longus. Now coming to the medial surface. Medial surface. The medial surface is concave from above downward. It is concave from above downward, and there is a shelf-like projection that you can see on the medial surface. Here is a shelf-like projection. You can see there is a shelf-like projection from the medial surface, and this shelf-like projection is called the sustentaculum tali. Sustentaculum tali, a shelf-like projection from the medial surface. This shelf, clear this picture, this shelf-like projection, or sustentaculum tali, okay, has got a superior surface, has got an inferior surface. The superior surface of sustentaculum tali bears a facet for the talus. So the superior surface of sustentaculum tali, okay, superior surface bears a facet for talus. That is obvious because overlying it is the talus bone. So superior surface of the sustentaculum tali bears a facet for talus. Superior surface, talus. What about the inferior surface? The inferior surface bears a groove for the tendon of flexor hallucis longus. The tendon of flexor hallucis longus, it passes like this, flexor hallucis longus. Flexor hallucis longus. It passes beneath the shelf-like projection. So inferior surface, flexor hallucis longus. Flexor hallucis, longus. Now the medial surface of this projection, medial surface of this projection, this is the medial surface. The medial surface of this projection, it is attached, it is related to the tendon of flexor digitorum longus. Okay, so if we separately draw the sustentaculum tali, this is kind of shelf-like projection. This is a shelf-like projection from the medial surface of the talus. It has got a superior surface on which there is presence of talus bone. Talus. Inferior surface, there is the tendon of the flexor hallucis longus. Flexor hallucis longus, and this is the medial surface. Medial surface. Medial surface provides attachment to the flexor digitorum longus. Tendon of flexor digitorum longus. Flexor digitorum longus. Medial surface. Flexor digitorum longus. FDL. Okay. Medial surface, flexor digitorum longus, like this. Now if we clear the diagram, Then and draw the sustentaculum tali once again. This is the sustentaculum tali, a shelf-like projection, superior surface for the talus, inferior surface for the flexor hallucis longus, medial surface for the flexor digitorum longus. So I hope everyone is clear up to this. Apart from this, the medial surface provides attachment to the following structures. The medial surface of sustentaculum tali. Where is the medial surface? The medial surface of the sustentaculum tali, it provides attachment to the following structures. What are the structures? Number 1, spring ligament. Spring ligament. Number 2, deltoid ligament. Deltoid ligament. Number 3, a slip from tibialis posterior tendon. Tibialis posterior tendon. Okay. Now, as far as spring and deltoid ligaments are concerned, I will just tell you this much, that spring ligament is present like this. It is called the plantar calcaneonavicular ligament. From the plantar aspect of the navicular to the medial surface of the sustentaculum tali, it is called spring ligament or plantar calcaneonavicular ligament or spring ligament. So spring ligament is attached to the medial surface of the sustentaculum tali. Similarly, there is another term we have got, that is a deltoid ligament. Now deltoid ligament is present between the medial malleolus. Here lies the medial malleolus of the tibia, medial malleolus. From the medial malleolus, a delta shaped, inverted delta shaped ligament extends like this. This is called deltoid ligament. Deltoid ligament. This deltoid ligament has 3 sets of fibers in the superficial band. The first set goes from the tibia to the navicular, tibio-navicular. Second set goes to the tibia to the sustentaculum tali. It is called the tibiocalcaneal. And the last set, posterior set, goes to the tibia, from the tibia to the talus. It is called posterior tibiotalar fibers. So these 3 sets of fiber together form the superficial strata of the deltoid ligament. So obviously a part of deltoid ligament, that is the tibiocalcaneal part of the deltoid ligament, is attached to the sustentaculum tali, medial surface of sustentaculum tali. Okay. So this is a brief description of the important structure that are attached and related to the sustentaculum tali of the calcaneus. Now we will see the sustentaculum tali from the plantar surface. Okay. This is the sustentaculum tali. Let me show you. If we clear the diagram, this projection, this is the sustentaculum tali. Here you can see the inferior surface of the sustentaculum tali, that is related to flexor hallucis longus. On this side, this is the medial surface of sustentaculum tali, to which all those spring ligament, deltoid ligaments are attached. Medial surface of sustentaculum tali, and the part of sustentaculum tali upon which the talus is sitting, okay, that is the superior surface of the sustentaculum tali. That cannot be seen in this diagram. That will be seen on the dorsal aspect when the talus is removed. So beneath the talus, like this, a dotted line. This is the sustentaculum tali. Clear? So there goes the discussion regarding the calcaneus. Calcaneal fracture or heel fracture is quite common when a person falls on his heel from a considerable height. The calcaneum breaks into a number of pieces and the fracture lines usually run vertically. So we have covered the largest and strongest bone of the foot, that is the calcaneus. We are now going to discuss about the cuboid bone. The cuboid bone is this one from the dorsal aspect, from the ventral surface or plantar surface. This is the outline of the cuboid bone. The cuboid bone is situated in front of the calcaneum and behind the fourth and fifth metatarsals. Fourth and fifth metatarsal. The cuboid bone present 6 surfaces: anterior, posterior, dorsal, plantar, medial, lateral. Let's discuss the surfaces one by one. First of all, we'll discuss about the anterior surface. This one is the anterior surface. The anterior surface of the distal surface, it articulates with the base of the fourth and fifth metatarsal bases. Fourth and fifth. So anterior surface articulates with the fourth metatarsal and fifth metatarsal. Then the posterior surface or proximal articular surface. This is the posterior surface. It presents a concavo-convex articular facet for articulation with the anterior surface of calcaneum. Here goes the anterior surface of calcaneum. Anterior surface of calcaneum, and together the calcaneo-cuboid joint. It is a saddle type of synovial joint. And the articular surfaces are concavo-convex of cuboid and reciprocally curved anterior surface of calcaneum. So it is a saddle type of synovial joint. So posterior surface, it is also articular. It forms calcaneo-cuboid joint. Next, we'll discuss about the medial and the lateral surface. First of all, the medial surface. The medial surface presents 2 articular facets. One articulate with the navicular. One articular facet is for the navicular, and another articular facet is from the lateral cuneiform. So medial surface presents 2 articular facets, one for the navicular and one for the lateral cuneiform. Lateral surface, just opposite it. The lateral surface is small and it is grouped by the tendon of, this is the lateral surface, it is grouped by the tendon of peroneus longus. Now peroneus longus kind of winds around the lateral surface and it passes through the plantar surface, passes through a groove on the plantar surface. Okay, and then it spreads like this for its ultimate insertion on the medial cuneiform and the base of the first metatarsal. So that is about the peroneus longus, tendon of peroneus longus. So tendon of peroneus longus groups the lateral surface. So lateral surface, peroneus longus, tendon. So far 4 surfaces have been covered. Then dorsal surface and the plantar surface. The dorsal surface is this one. This is the dorsal surface which we can see from the dorsal view, and this dorsal surface, it is rough and flat, and it provides attachment to different dorsal ligaments of the foot. Dorsal ligaments of the foot. ligaments that connect the dorsal aspect of the neighboring tarsal bones. These are called the dorsal ligaments, and they are attached to the dorsal surface. Now, what about the plantar surface? That is important. Now, plantar surface, here you can see the plantar surface or the inferior surface presents an oblique groove. This is an oblique groove on the plantar surface, and as I have already told you that this groove, oblique groove, it lodges the tendon of peroneus longus. So plantar surface, it lodges the tendon of peroneus longus, PL. So peroneus longus, after it cuts through or grooves through the lateral surface, it passes through the inferior or plantar surface. So that is the description of the cuboid bone.